Assalamu alaikum, everyone. Welcome back to another episode of the Medical Talk. We have the first episode with our new team member, Sahar Khwaja. She is a second year medical student, and I'm so excited to have her on the team. Thank you so much for joining us, Sahar.
Hello, Nushay. Thank you so much for having me.
So, our guest for today is Dr. Lubna Najmi, who is a graduate of Ziauddin Medical College, and she just matched at Rochester General Hospital in New York. She is an outstanding student. She had a 269 on her step two, which is insane. I'm sure that we learn a lot from her. Thank you so much, Dr. Najmi, for joining us. She's actually moving to the US very soon, and she took out the time for us for the podcast. Thank you so much for joining us.
Thank you so much, Anushay and Sarah, for having me today. Honestly, it's my honor. And thank you for such a great introduction. Thank you so much. And I'm looking forward to having a good chat with you both.
20th March 2026, the match day when you found out where you matched, and a week before that, when you found out that you had matched. What was that day like? Can you give us a rundown of the day and share what you were feeling that day?
That's a great question because no one's actually asked me about like how it went down. So I think it was Chandrat on 16 March. The next day was Eid, and I was working as an intern in AKU, and I think I was post call on that day, and the night before, actually, I was like, this time next day, I would know if I've matched or not. I'll be panicking, or maybe I'll be planning for the next year's cycle, or I'll be either thinking of packing my life. I don't know how it's going to be. And I think and it was actually iftar time, so I had my phone with me and just constantly checking. It's 7, and a lot of people had already told me that it was 7 p.m. Pakistani time where they send out emails, but some people said that it's actually 10 minutes before that. So it's going to be already there. So I knew, and I had purposefully turned off my email notification because I was like, I'm not going to do that. And then I'm just like postponing. Just, I know it's 7 p.m. I know I have the emails. It's like, it's okay. It's okay. I'll just clean the table, I'll just pick up the leftovers. It's fine. And then I started getting a lot of calls and messages from, my friends who were in the match cycle. No one was asking me about my match, but they were just, like telling, oh, I did or I did not. And then I was like, okay, let's just, rip the band-aid off. And I remember I was very particular about my reaction video. So I set up my camera with my family. And I was like, but it's, I don't know, I was just a sense of peace and calm deep down. I know I was just not expecting this because, I've always, since first year, I think for any med student who aims for USMLE, this is that one moment. But I think on that particular day, or for some reason, I was just very calm. I was very, like whatever it's going to happen, it's going to be for my good. And I've given everything. So if it doesn't work out, maybe it's just something, it's going to be good for me. Anyways, I just opened the email and I was like, I just a small jump. And I was like, oh, I did it. And my parents, everyone's crying. My sister's crying. I'm crying. And I'm like, this is, in that moment, I was just like, it's over. Like it is over. I've been in it for 2 plus 3 years actively, and the planning for 5 6 years. And I'm just like, it's done. That is it. Like, but I think after that, for 20th March, actually, I was Rochester was I believe it wasn't, I wouldn't say that was my first choice, but I was still very happy, and I think now I'm much more happier. But I was anticipating more towards the other program, but I guess this was for my good. This was for my good, and I see it already. And I think that was in itself, I would say, overwhelming. But again, as I said, it just felt like it's done. I'll see all of it on the other side.
I think the first thought that you get is what next? If I'm not wrong, what next? Because we've been in this journey for so long, and I'm sure you spent the last 5 6 years just working towards it. And then once you get there, you have it all. Then what do you do next? Because we're so used to the next
Exactly.
milestone.
No, you're actually right, because I remember having this conversation with the few of my friends who were in math cycle with me, and I was like, I feel like at this point I'm more prepared about what if I don't instead of what if I do. And they all were like, I get that. And I was like, I'm just more thinking of, okay, I'll improve my application like this. I'll go for step three, I'll start looking for observerships, research, whatever. But I never actually, you're right. Actually, I never really sat down and thought of what if I do, what's going to be next, I think for that, I took an entire 2 months for the first 2 weeks, I was just very, oh, I matched, like everything is done. I've like accomplished it. Now I can go sleep, kind of situation. But then after 2, 3 weeks, reality started hitting. I was like, oh my God, I'm moving away. I'm gonna, like, this is it. Life is gonna get real now for sure.
That's actually very interesting because I love hearing stories about people's reaction to the match and how they felt right after it.
I keep going back to that video and I'm just like, I did a small jump and I was like, oh my God, I did it. And then I start crying.
Amazing. Thank you so much for sharing that, Dr. Najmi. So you did mention that since the first year you had that in mind that you're going to do the USMLE pathway, right? But when exactly did you decide that this was the path for you? And like, how did you structure the year between graduation and the match itself?
Yeah. So for me, I think I wouldn't say exactly first year, but it's that kind of thing where you hear from your friends. I don't have any family in US. I mean, not in terms of like the doctors. And the doctors that I had in my family, my uncles, they were all in UK. So it was always for my dad, it was like you have to do PLAB and then you're gonna go to the UK and his family there. Perfect, great, right? For me, I just never felt okay with that, and I just like, no, I do wanna see where this goes, and there's this famous YouTuber also, Karma Medic, and he's also, I don't know if you guys know, he's UK based. So I used
Yeah.
to watch so many vlogs and I used to show my dad, but still I was like, I want to live this life. Like I want to practice abroad, but I don't maybe want to do it in the UK. And so I started, I think, mentally preparing myself. My dad, I was like, I'm gonna go towards the USMLE side. And so, at that time when I entered med school, it was more of a like, oh, my friend's cousin did it, or my friend's sister did it, they matched. And I was like, okay, that's something that they do. But it was always like, especially when step one was scored, everyone was like, oh, you have to work so hard, it's like near to impossible kind of thing. And I was like, okay, we'll see. But I think in second year is when I very actively got into it. I got in touch with a lot of seniors, not in terms of like, oh, I want to do USMLE, but just, I would just look at them with those puppy face eyes would matched, and I would just be like, oh my God, like they're there. And Sarah, maybe but in Zaudin they put up this Meet the Match poster and they lit like printed and they put it on the entrance board.
Yeah.
In March, I would just go and stare at it like this, and they'd be like, oh my God, chill. So I think in third year is when I mean I would say comparatively from what I hear about from Anusha's university as well now, a lot of med students I think start preparing in second year. But for me, I think I started in third year after we are done with it. I think all the basic sciences and I think forensic and community health sciences, because for us third years end the last semester and we had semester system. So third year last semester was like the chillers for us, and then fourth year is also chill for us in Zaldin. So I started then actively like watching both and beyond, and I think in fourth year I got my U-World. So I would say I actually very actively started in fourth year, and I ended up giving it in the first month of my final year because we had prof in between and I couldn't schedule it before my prof because I was very particular about my grades in med school as well, which I see like a lot of people just easily let go of it, but for me it was a very big deal to just ignore an exam. So I always had to make sure that I'm like doing really really good in those, and also so which is why I think my exam got delayed a bit, and I ended up taking it in final year, which I personally think is a great timeline. If anyone takes it in final year or even like the next year of graduation, it's a perfect timeline. According to me and my experiences and what I've seen. So I ended up taking it then. And then the whole final year. So the good thing, what I would say, why everyone should, I would say, take it in final year and why I got lucky was because when I got my step one report, or when I was actually applying for my step one and giving it, I wasn't thinking of, I have to go for electives. In that moment, I just obviously had to pass this because step one feels such a big exam that everyone wants to get done with it. And I wasn't thinking beyond it, which I should have, but I just, arranged my visa situation. So I had my visa interview scheduled the same week as my step one. I took my step one and I got the visa as well. But what good thing was that when I got my result, then I opened the VSLO portal and I realized that, oh my God, I can apply to Mayo Clinic. And I just have 5 days though for this. And they do require step one, by the way, for Mayo Clinic. So in that moment, I was like, oh my God, I'm right in spot. And the months that my university has given us for electives, I think I can apply. So I maybe should shoot my shot. So that's one good thing I think that came out of it. I could have given it later in final year as well because there was the entire 3 month break for electives. But then I would have definitely missed this math cycle as well. And
Yeah.
I would have missed my one chance at Mayo Clinic as well. Because when you apply to Mayo Clinic, there is this box which you have to check in, which says that if you do get accepted or you get rejected, in either cases, you can never apply again for
Yeah.
a visiting medical student elective. Yeah. So I was like, oh my God, I recited everything that I know. I prayed as much as I could. I was like, this is a once in a lifetime chance. So then I did get my electives. I got actually just Mayo Clinic, and the other two that I did were sort of externships slash observerships, I would say. And then I came back. I gave my prof, which was around December of 2024. Then also, when I was gone for my electives, I had already started studying for step two because for me, I always knew that I'm going to take it after my final year, but I just wanted to solidify my step one knowledge because the way it had helped me for my step two, I could not have done it if I had taken it 2, 3 years after my step one. So I started doing UWorld, but it was not very active, but something like doing a block every day because you're already so busy, especially not the two observerships, but Mayo Clinic was very hectic because it was an ICU rotation and ICUs are 13-hour, 12-hour. And of course, because I was there for an LOR, I would make it into 14-hour shift. So I started doing, I would say, 40 questions every day. And I actually used my final year to help me with UWorld. So especially medicine. So when I would study medicine, whatever system I would study, I would do UWorld of that at the same time. So and actually, I would say it did help me get like good scores in my final year exams as well. And
Yeah.
then right after my final year, I think after my prof, I took a week or so. And then January onwards, I went into my step two. I had a few personal issues, which is why I delayed. And I ended up taking in July of 2025, which is very close to the math cycle. And I never actually had aimed for maths 2026 because I was always hoping that my score is going to decide if I sit in this one or no. Because I'm not someone who's very big on research. And I knew that I'm not going to travel again the same year for more observerships as step three. So for me, in that moment, I was just like, if my score is something which I have always dreamt of or prayed for, only then I'll appear for the math cycle. Otherwise, I'm not going to sit. And so when I got my score, that's when I decided, I think it was late August, when I decided and I got my token actually on 1st of September and 22nd September is the deadline. So that was like a rundown of my math cycle.
Yeah, that's very interesting because a lot of people they start very early, but then they get a bit complacent in the middle and then they think that they have a lot of time. But I feel that you just need to be very focused towards your goal and what you really want to do with it. Similarly, with step two, I think I completely agree with you because being in the same position right now, all of the things that you study in final year really, really helps you in step two because it's essentially the same thing, just tested in a different way because the
Yeah.
medicine is still the same, a little bit difference with the guidelines and everything, obviously. But with your step two, you have an amazing score. So, what were your resources and what were some of the things that you think that you did differently that really helped you achieve that score?
That's actually, you're so right about final year. So it's, I think definitely the way they ask is different. And I think I know that UWorld and Amboss, they have like very strict guidelines and algorithms to go about. But you're right, like the basics are definitely the same. And I I tell almost everyone, a lot of final years or fourth year people are also reaching out about their step. And I was like, your final year, whatever you study for your final year exams, it's not just going to help you get a distinction in your final year, but also definitely going to solidify your, step two stuff. So for me, I think what I know, like a lot of people tell you already about AMBOSS in addition to UWorld. But for me, I think AMBOSS was game changer. Now, I don't know if it was actually or if it was a placebo effect. I had actually read a research. There was this meta-analysis, or there was this research on PubMed which said that students who use AMBOSS actually scored 10 points higher on their step two. I was like, this is it. That's the day when I bought the entire thing. And this is like, I think this is like 1.5 months before my actual exam. And I was like, this is it. Now I'm going to get those 10 points higher than average student. And I think, but jokes apart, like besides Amber's, ChatGPT. I used it. I discovered it actually in 2025, weirdly during my final year prof. But the way I used it in my step two and the way it helped me, I'm not even joking that I made these extensive, not extensive, I would say, but I made these documents using ChatGPT, which helped me. And I think so I'm basically in my med school, like a lot of people know me because I circulate notes, I make them and I share them, and then they're like shared in big groups. So a lot of people who got those notes, they all like texted me later and they were like, oh my God, your notes are like so solid and everything. So not just that, but I think they helped me personally so much. Some people found them extensive. I know like just varies, but how I structure them and how I tell everyone is that, your first pass is that is the same for everyone. You do you do your 100% of UWorld, and then you decide. But that was the point. For I think I wasted a month as well deciding what I should do after doing that 100% of UWorld. So in that moment, what I did was that I was doing AMBOSS. I bought AMBOSS and I was like, okay, I'm gonna do some. Actually, no, wait. I did incorrects. I didn't reset. So a lot of my friends also did reset. And for me,
Yeah.
I would just didn't want to. First things, I was bored of UWorld. I was like, I've seen this so much. And then when I tried to do incorrect, even then I knew that there was this bias. I knew the answer unconsciously, subconsciously. I was just like, I know what you're saying, but I just don't know why. But oh my God, I'm so happy I got a 90%.
And you
And then
keep
I
doubting
realized,
yourself as well. That maybe
yes,
was this the answer that I actually clicked last time, or was this it? And then you get the question wrong sometimes because you're second guessing so much. So I think it's not
as
that helpful.
it's not at all, because you're right, actually, because even if you've learned something new, let's say, and this is true, but last time you don't know what you were thinking and you just, that's just like a lot of overthinking, and then somehow you end up getting it wrong or right. Either ways, it's not a good predictive. So what I did was, in that particular time when I was done with my 100% UWorld, I went to incorrect. I think I did like about a week of all my week. Like I remember cardio was something that I was struggling with because I had done it a year back. So I did incorrect of those systems. I'm not a random block person. I'm always a system tutor, like solidify your things. There's no point in doing random blocks, because for me it's like, today I know pulmonary embolism, I want to do a CTPA. Tomorrow, and then in a random blog, I'm gonna get to know that no way, like do a VQ for a pregnant female. So that kind of stuff, I was like, no, if I'm doing pulmonary embolism, I want to know everything that I can in the moment. So what I did was I did incorrect, and I would keep going back to first aid of step one to reread those topics. And I had also saved PDF of Inner Circle. So I would just, read up. So just like I said, I got a question of pulmonary embolism. I read up what I was wrong about, but I also make sure to read up enough that I don't get it wrong the next time. So once I had put this another layer, I would say this was another layer that I put in of all these systems. Then I tried to do CMS forms. So that was my next, because someone told me that CMS is a bridge between NBMEs and UWorld. So I started CMS forms. CMS, I would do initially, of course, it takes you time, but how I would recommend everyone doing is that you do medicine, and then you don't do two forms of medicine only one day. You do another subject. So medicine and peds.
Yeah.
And the next time you do them, you must have reviewed the medicine and peds from the last time. So medicine and peds, 100 questions a day. surgery and obs gyne or like peds psych together, neuropsych, whatever. The point is that you don't do like two
Of
forms
the
in the
same
same
subject.
forms of the same subject in the same day. Don't do that, because how are you going to improve? Even though CMS scores are not that predictive, but still. And then what I was getting wrong in CMS, so at that point, there was a point where I was treating CMS as my NBMEs.
Mhm.
What I would get wrong in CMS, I would make targeted blocks in ambers.
Mm.
So I would go to Ambers and I would be, and it would be so targeted that I remember if heart failure was my problem, I would go and I would literally mark heart failure only and do blocks of that. Or let's say neuropathies were my problem in neurology. I would go and I would just focus on that particularly. I remember in or like MSK in ortho, those joint pains, all of that osteoarthritis, juvenile spondyloarthritis and orthopathies. I would go make a block of those. So, targeted studying like that. And then I remember once I had done about three, and I started doing early forms. So I think I started from three, four, five, because there's like 8 forms of majority of the subjects. So I started from three, four, five. And once I had done about 3 to 2 forms of each subject, I took my baseline NBME, which was NBME 9. And I don't mind sharing my score. It was around 236. And I was not completely shattered, because I was like, this is fine. Okay, I can build on it. But when I started comparing it with people who had already scored 260, I was obviously crying. So this one thing, please, please, if I tell my trajectory honestly to you guys about my score, no one would have believed that I would end up with a 269. So obviously, but that's me. Everyone, and because I was constantly on Reddit, there are like other groups as well who are doing a great job mentoring people. But on those groups, I was reading trajectories and I was like, I'm never gonna get this score. I started from a 236. They started from, 245, 250, and you're always comparing. That's just
Yeah.
it was so bad. My anxiety was all over. Like I was all over the place. And I was like, I stand nowhere. So don't compare yourself. But I took my NVMe 36, and then after that, I took about 2 weeks reviewing stuff and use ChatGPT. So this is something that I think this is one of the highlights, and I think I tell everyone to use ChatGPT this way as well. I went on ChatGPT, and there's Amber's GPT as well, but it's not that extensive. You can try if you want some very reliable information for sure, but I think ChatGPT is just fine. So in ChatGPT, I gave prompts like I'm studying for step 2 NVMe. Hi, G, tell me, I got this, and sometimes I would screenshot the NVMe questions or copy paste it directly into my chat GPT. And I would be like, I marked this, answer was this, tell me why it was this, and make sure I don't get this wrong the next time. And tell me everything I need to know, but also enough for step 2 NVMe high yield. And then when you chat, there's a chat that is formed. And so even if you don't give it prompt, it's just gonna think in the same
Mm.
way. So, and then ChatGPT would literally break it down for me, everything that I needed to know. And I would copy paste that into this Google Doc that I would make I even made documents for CMS forms. So I would review CMS forms in the same way as well.
Mm.
So by the end, I remember I had subject-wise documents, CMS, Neuro, CMS Psych, and those were my own personalized review documents.
Mm.
I didn't make those documents only from ChatGPT, of course not. I use Inner Circle. I think there's a lot like White Coat Companion. There's like a lot of notes. I only knew Inner Circle, so I use that because in Inner Circle you would just type the keyword, the UL table pops up in front.
It pops up, yes.
I would screenshot that. I would put that and then add that you did this. This was how you were supposed to think. Because in step 2, there was a point where it's not like I think that I know everything, but there comes a point where you're like, I've done everything. Why was my score not budge? And in that moment, I realized it's the pattern recognition. I
Mm.
need to work. And someone on LinkedIn actually said that think like a doctor. Like if you were in clinic right now and a patient came to you with whatever symptoms, how would you get that kind of extensive testing? Would you want to do the chillest non-invasive thing? And let's say if a patient comes to you and you can clinically diagnose that patient and get them started right away, would you still send cultures first? Would you still do like an extensive MRI or CT? And that is something that really helped me as well, that you got to think in the way a doctor would think if they were in your position, if you were in a clinic, or if, let's say, you were rounding, or you were in the ED, whatever the scenario is. But I think I made those personalized documents, and those were my go-to. Before, I remember, right before my exam, I had, so at the end, I had like NBME 9 to 15 documents.
Mm.
And those were my go-to. Any subject, any topic that I would feel like, oh, I need to review this, I would go to that.
Mm.
And leukemias and lymphomas, everyone hates those. Everyone
Yeah.
hates those. I I asked ChatGPT to make me a table in, the specific way, give me diagnostic buzzwords. I literally asked ChatGPT to make buzzwords for you and for step two, and like if anyone's watching this for step one even. And I think ChatGPT does a great job.
Mm.
And I would, you can ask ChatGPT to make it concise. They'll do it.
Yeah.
Heart failure, like murmurs, such a crazy topic. I asked ChatGPT, they're giving heart failure in so many different contexts. So for in step one, it's heart failure, simple, that's it. But in step two, there's so many different etiologies of that heart failure, so many underlying things.
Yeah.
I sat down, I was like, tell me how step two is going to ask how NBME or step two NBME is going to test me on heart failure. What are going to be all the ways, all the underlying etiologies and buzzwords for each one of them, which would help me recognize and reach. So I think Chat GPT, and then last of all was something that I realized it later, is doing questions. They are right when they say this. I know a lot of people already know this. A lot of people have heard this, that the more questions you do, the better you're gonna get at it.
Mm.
And in the end, when you've learned everything, when you've gone through everything, I'm supposed, if it's appendicitis, I know what test I want to do. I want to take the patient to surgery. Still, you can get some things wrong if you have not done enough questions. So
Mm.
I think questions are, in the end, when I had done my NBME, last NBME, I was just chilling. Like, there was 4 days before my exam. I had taken free 120, and I didn't score that great. I think it was like a 72%
Mm.
on my new free 120. I was panicking. And what I did was, I was like, it's okay. My exam is in 2 days. I'm going to go on Amboss. I made a random block of 20 questions. Like, I'm just going to solve it because I want to make sure that I still know how to
Didn't
do
know.
questions.
Yeah.
I went in, I was like, okay, I'm getting a 90 plus. That's fine. I
Yeah.
don't care what free 120 is saying. It's fine.
Yeah.
I know my shit, and I went in.
At
So
one
I know it's
point, you
different
have to.
for everyone.
At one point, you have to ask yourself, is there anything else that I can do anymore?
Exactly. Yeah.
The same thing happened with me with my step one. So I did not score very well on my free 120. It was around 70, 71. And I called my friend and I was panicking and I was telling her, Maybe I should delay my exam. I have my exam in 3 days. What do I do?" And then she asked me this question: Is there anything else what are you going to do after this? Do you have a solid plan after this? And my answer was no, because I've done anything and everything that was in my capacity to do. So she just
Yeah.
said, go to the exam, everything, it's going to be fine.
Yeah. No, you're so right about this, because they are predictors for sure. But I mean, I completely do not have any faith in these NBME predictors anymore. And there's like this Amboss predictor, Chat GPT, they all
Yeah.
were like, on a very good day, your highest is going to be 255 or 256. I was like, okay, fine, whatever, I don't care. But you're right, because for me as well, I was in that position before my step two. Because of some personal reasons, I was not in the mental space to take it, and I was like, but if I postpone it now, what am I going to do? Because I'm left with two NBMs. You know, what will that get me? And I was like, it's fine. I can't do much, because if I postpone it, what am I going to do? How am I going to improve else? So once you reach that peak, I feel like, where you genuinely feel like this is it, I think you should just go in with the exam and have faith.
Definitely. I think that's one of the most extensive talks I have had about step two over here. And I think it's very helpful because I'm in the same position right now. I had the exact same thing happen to me with my first NBME, and I have to take my second one. And I'm just hoping for the
Oh my
best.
God, good luck. You're gonna do great. You're gonna do great,
Thank
inshallah.
Yeah, Dr. Najmi, thank you so much for going into so much detail about how your experience was. And it was very real. And I think a lot of students will feel a lot of comfort hearing that it came from you. So we move on to the next segment of our podcast. errors in applications. So, like, what made your personal statement strong? And what mistakes do you see applicants make usually in their application?
That's a great question. So for me, I think for my personal statement, I think because actually the program I matched at the second question that he picked on was about my person. He picked a random line from my personal statement, and I think why he liked it or why people talked about my personal statement in my interview was because I put a lot of my qualities in a way that I was explaining it in a story, like it was going like a story.
Okay.
And I didn't start with, like a sad, or like, how they say, do not start with a sob story or something,
Yeah.
like tragic thing that has happened. And to be honest, when I was writing my personal statement, I was looking for any kind of, something, something out of the blue or something out of the world completely is going to make the document be like, oh my gosh, this is it, it was not nothing like that. But I just genuinely, I was just sitting and I was like, I read so many personal statements. There was nothing which was, I could even try to little bit, go in that direction and be like, okay, this is something I can adapt or, somehow put my story in it because I genuinely don't have any, great story like that. But I had this one patient encounter I had and during my elective at Mayo Clinic, and that I used in my persist made the statement in a way that I based it on one of what actually has had moved me and brought and made me feel even stronger about doing inpatient in future and currently like internal medicine, let's say, for now. And I think just being on the floors. And it was this one patient encounter I had. This was this elderly lady. She had really bad cirrhosis and then she had hip fracture and she was just not a good candidate for the surgery, but the family was really adamant and we were trying so hard to just bring her platelets to, enough to make her, a good candidate for surgery, but it was just not happening. And it wasn't the patient who I bonded with, but it was actually the patient's daughter.
Mhm.
And it was just like an interaction between me and the patient's daughter that I started my personal statement with. But I didn't go on too long about it. I just used that as my anecdote, the hook that they talk about. You want to have a hook, and I went on from there. And I think I put my the biggest thing in my life is that I moved. I moved cities.
Oh my God, same.
And so, right.
Yeah.
So, and
I moved.
how was it for you?
So I moved around 8 cities across Pakistan because of my dad's job. And I think that is the one thing that has shaped my personality. I think I give most of the credit for my personality and the way I am to that because it completely shaped my personality in a way that I feel I can interact with a lot of people. I can understand a lot of people, something that has really impacted me.
Girl, you have moved. Oh, I have not moved at all as compared to you. That is great. That is great. I have moved, I don't know, like maybe twice or something, but I put it in a way because I'm from Hyderabad, right? Originally. So I use that and I try to explain, show my things that are truly, you just gotta sit down for anyone who's like trying to write a personal statement, which hopefully you guys will be at one point and very soon, Anusha. But just list down what you think is definitely your strengths and think around it.
Yeah.
So for me, I was definitely looking out for being very adaptable and very easy to just fit in basically. And when I moved, I didn't just move to just chill like moving. I directly came to my to start med school.
Mm.
And there's a whole like I would say like a little bit of a struggle over there. And you have no friend and you've also moved a completely different city and everything. And then I tried to link it with how I was trying to adapt to the US healthcare system as well. And how, that has always been a challenge initially because I also wrote the fact that that I had imposter syndrome. And I remember like two APTs just hanging on to it and they were like, explain this. So I think I used that and I think I just wrote what I truly was feeling about what is my strength. I wasn't looking for something very out of the blue, because you're gonna, when you get into the cycle, a lot of like personal statements are going around, and you're just like, you start comparing, and I was like, mine is nothing, like mine is a regular person statement. But for me, I think it just gave the message away that I wanted to give to them, that this is who I am, and this is who I'm going to be with, or who I'm going to be if you work with me. And this is something that they also talked about in my interviews, that you mentioned this and you mentioned that, and can you give me example of that? And they also, I think one thing which is going around so much is using help from people, paid or unpaid or whatever, but using help for personal statements. And someone tried to ask me that, and it didn't, I wouldn't say that I was very happy to hear that. It did make me mad somewhere, but more than that, it made me scared for them, because they literally, the program that I matched at, actually, they literally picked on random lines. You know how you just put those
Yeah.
phrases, the dramatic lines. I remember my APD was like, you've used a line which says, walking between uncertainty and these walls, something like this. And I was like, he was like, what was your thought behind it? What
Yeah.
are you trying to say with this? And I actually had a thought behind it, so I talked about it. So I think just the best thing you can do about your personal statement is, and I didn't make it about internal medicine, I just gave it, I think I would say 2 to 3 lines
Mm.
of why internal medicine. And I also tried to summarize all the big achievements of my life in a way that I talked about how I was president of the whole student body in my high school.
Mm.
And I use that I learned leadership from there and teamwork from there. And I try to put it in a way that internal medicine and all these, they're just, floors are based on teams. Teams
Yeah.
run floors, and if you don't have a good coordination in team, you're just going to be either the one who's sulking and just being really sad, lonely on your night shifts, or you're just going to be swamped with work because you're too egoistic, you can't share, or where you can't ask for help. So, these kind of things where you wanna tell them also that, hey, like, this is who I am, and this is who I truly am, and this is something that's gonna benefit you. And for my ERAS application, for I think what people, that was the next question, that what the mistake that people are doing. I think a lot of it goes into the way that you phrase and word your ERAS CV. Like big time for sure. Because a lot of people, I think, at Seher's point, a lot of students, where you are in that, just thinking that, oh, I want elective, I want a hands-on elective. I'm not going to do observerships, I'm not going to do externships. I was there when I was looking for electives. I was like, it has to be a hands-on elective. It cannot be an observership. But I ended up doing 2 observerships, and the way I wrote it, I was like, this is hands-on, because I did it during my student period, and they were like, okay, the way I described my things that I've done, that is what made the difference. That is what made them come. They were like, oh, you've done all of this. You worked with both the Epic, Dragon, all these healthcare EMRs. And I was like, yeah, I've done this. So it's a lot about the way you phrase it. My ERAS CV, for example, had 3 electives, and I think tutoring experiences were something that was majorly there for sure, but the way you phrase it. So like, I was tutoring US medical students very actively during my interview season. So that was something that was talked about. Just telling them that, I'm very familiar with how the culture over there works, because I've worked with so many US medical students. I worked with people from there, HR, all of this. So I think that is something that makes a very big difference, because it's not just having big fancy experiences. I wouldn't say I have anything fancy besides Mayo Clinic on my ERAS CV, like my experiences list. But most of it was just, random volunteer things that I did in med school, like tutoring, study guide committee. We have this where we used to compose documents, review documents. So I was just like, I did that, some camp stuff, but nothing fancy, but the way you phrase it, I would say.
The impact that you're creating, essentially, because if you're
Yeah.
doing something that has a very big name and you're just standing there doing nothing. So I was at Houston Methodist, I was at the cardiovascular ICU, and I had the best time over there. It was one of my best rotations because my attending was amazing, first of all, and then I used to help the physician assistants with the chest tubes, putting in the catheters, putting in the art lines, everything. I used to be there. That was such a great experience.
You know what, Anusha, he is, whoever your preceptor is, he or she, they are going going to include this in the LOR, and that is what makes a difference. Like people ask me that, I personally think why I matched besides my score is my LORs.
Yeah.
Like I do not even think that maybe I don't think like I have like a very like out of the, one in a million CV or something, or someone could not have that. But I think my LORs were something that was my strongest pursuit. And I think it's only because I was just like you said, like I was so proactive. And I think you don't have to be just proactive, like doing things. Like, yes, that is for sure. That is why you're there. But when I saw that is in the moments where I was like, oh my God, I'm just sitting. I feel bad, I feel
Yeah.
bad. What if I'm invisible? So I would just randomly get up and I would just start chatting with the residents over there. I'll start connecting with the nurse practitioners, the team over there, the respiratory therapists, because ICU has a big team
Yes.
usually.
Yes.
So I would just chat with them, just chat with them. That's it. And I think that made a big difference. That makes a big difference. And just like you said, you have to take the initiative. Because just like an elective you would do in Pakistan, or I don't know how rotations are in Dow, but in our med school, rotations are pretty much just following the doctor.
Hmm.
Just going around. You don't know much about the doctor, or you don't know much about the patient, but you're just going around. Um, and so when I was in Mayo, I was like, if I want to be prominent, I want to ask questions there. So obviously that was like a sub-I situation. So I was presenting, I was responsible for patients. That was a different situation. But still, initially, when they were treating me like a warm-up kind of thing, they were like not giving me anything. And I was like, no, I need to do something. I would just take the initiative. I was like, there's this new case, there's like a very unique case of chart syndrome. And I was like, can I go examine that patient? We have an abdominal aortic aneurysm. Can I go palpate that patient? Stuff like this. And then they started being like, oh, she's interested. She wants to be here. She is interested. Let's give her stuff. She skip. And, you have to show them in some way that you're capable.
I've had a conversation with a lot of doctors about this on the podcast, because there are a lot of doctors who take students for observerships and electives, and this is exactly what they say, that I need to see initiative, and then I'm going to understand that this medical student is capable enough and is actually interested in the elective. And then it reflects in the LOR. So with your LORs, when did you ask your preceptors to start writing the LORs? What was that process like? And what do you think was something that really stood out in your LOR, as you said that they had a huge role in your application?
Okay, so I think so first things, of course, how you always generically ask them when you're doing your rotations at the end or in the beginning that, hey, I would like a letter of recommendation if you think I'm capable enough. So after that, one time, I think I did mine in 2024. So they said, yes, whatever, blah, blah, blah. I was like, that's great. Thank you so much. And then a year later, of course, now that is, I think, something that also made a huge difference is that during that 1 year, I was in touch with them.
Okay.
They were Pakistani preceptors, and at Mayos, of course, they were all white. So, just wishing them Christmas, Thanksgiving, that was regular stuff. And same goes Eid, Bakr Eid, whatever, with my Pakistani or the Muslim doctors, or if there were any Indians, I would wish them Holi, Diwali, that is regular stuff. But besides that, I would update them on where I am. So when I graduated, I was like, hey, I graduated, I visited you and it was such a great time. I learned this, I applied this, and I got a distinction in medicine because of what I learned from you. They were like, that's great. I was in touch with them this way. I got a gold medal. I was like, hey, I did this, I got my step 2. Oh my God, I did this, so this way I was constantly in touch with them. And then, as I said, I was very late. I took my token, and when I got my, I had already, I think in August, I had already reached out to my preceptors that like I am now officially planning for the math cycle, and so they were like, okay, but they were like, when you get your token, you have to make a request. When you get your token, ERAS token, you have to send a request from that official ERAS portal to the doctor's email, and then they get it on their portal and they upload it. So when I got my token, I emailed my preceptor. One of them is a very nice person. He was a Pakistani doctor, and he said that and that is when I realized. I was like, okay. He literally texted me. He was the one who was like, where is your token? And I was like, I'm getting it, I've just given my OIT. Actually, I had screwed up. I couldn't give my OIT in Karachi. And so I had to travel and there were no seats. So the
Oh.
earliest date that I could get was 1st September in Islamabad. Anyway, so I was like, I'm getting there, just give me 1st September. And he was like, all I'm saying is that I just need a lot of time to write yours. And I was like, okay, that's something. And same goes with the one that I requested for my Mayo Clinic elective. I was like, I need my LOR, and he was like, you gotta give me some time to write yours. And I don't know what they wrote actually. I just know I actually don't know because I waived them, but I know one thing that they wrote is that obviously the examples and everything, but there's this one line, I don't know if you guys have heard of it, but I actually very recently got to know about it as well, is that when a preceptor uses this particular line for you, that this student works at the level of a resident or beyond that, or an average resident, that is something that is, top tier, and they don't use it for everyone. And I know this, that one of the doctors or two of them have actually used that, because Mayo Clinic sends a final evaluation to your medical school directly. And so my dean invited me and he was like, let's discuss your evaluation that we have received. This was when I was in final year. And then he read it out to me and he showed me the print and he was like, this is what they've written. And I was like, I see. And so it had evaluation from all the residents and fellows I had worked with. So there were like paragraphs from each one of them and the consultants. And I knew that this was this one particular consultant because he had said it to my face as well. And when I was, saying goodbye to him, I was so sad. I was like, I'm gonna miss you. It was like this was organized person. So I think that is something. And what made me get those or get to that point with them, besides the fact that staying in touch is such a makes a huge difference. It makes such a huge difference. And the other thing was that I was very proactive. First rotation that I did was internal medicine inpatient. And when you are doing inpatient, you have mostly a lot of things, but a lot of micro, a lot of like infectious, you have a lot of cardiovascular going on as well. And as I said, I had just done my medicine rotation in my med school. So I took my notes of that. So, the basic AFib, basic rules of anticoagulation, all this stuff, I was just reviewing it. I was like, I'm going to talk about it. And he was the kind of person who would ask me as well. He would ask you Q&A. And I think that was also based on the fact that I was asking him so many questions. So whenever I would see that this is getting a little boring, I was like, yeah, I had another friend of mine with me. So it was two of us. But I would be like, why are we doing this for this patient? So he would be, there would be cross questioning. And the next one that I did was a cardiology rotation. I wouldn't say that it was very like there was anything that I could have done too much in that one. As I said, it just varies preceptor to preceptor. But besides that, in the Mayo Clinic elective, I would say every preceptor is different. So obviously, some give you a chance to speak up, and they want to evaluate you. Some are like, okay, just do your rotation and go. It's fine. So obviously, in those cases, there's not much that you can do. But in the Mayo Clinic elective, I was actually having imposter syndrome. I was like, what am I doing here? What is happening, and so fast paced and everything. But the residents were super nice, so they would help me a lot, and I would just, I sort of became friends with them, and they used to tell me, do this, do this. They would just give me a heads up because in ICU there's like a new attending every Monday.
Yeah.
So they would be like, the next doctor who's coming, he's like a big gun. You want to impress him and everything. And I was like, okay. But what I would do is I would always speak up. I remember that my voice was so shaky. I was not having I remember the first time I presented patient in a full team and not a single, familiar face. And there the teams are huge. There's like a respiratory therapist, there's a nutritionist,
Yeah.
there are like 4 or 5 residents, a fellow, attending, a nurse practitioners. And it's like a big deal. And I was like, oh my God. It's the first time I presented, my voice was so shaky. I was, I read the entire thing. And they were like, you did it great. It's still, they were very encouraging. But then they later on told me, like, you could, just tell the most recent updates. You could go in this way and, it's completely fine. with the accent and everything. It's completely fine. Even the attending, I remember he was so nice. He was from China. And he was like, I've been here for 20 years. Do you look at my accent? And I was like, you're right. And he's like, it's completely fine. And my fellow, she was from Bosnia. And she was like, it's completely fine. I got better with that. And then I remember this one time, now this is the time when they told me that, oh, the big gun attending is there. It's his first day. And you don't want to be late, you want to be on time, you want to do this, that. I remember and the pharmacist was asking about some medication. And because I had recently given step one, it was a
Yeah.
very core, like, book. I think it's Suvorexant or something, which is not a very clinically used medicine, but it's very new medicine. So it's more, I think, theoretical. So, anyways, because he was pharmacist, he was like, how about we use this? And so the entire team was like, what medicine is that? And I was like, should I say it? Should I not say it? I remember I was started sweating and I was like, it works on this receptor, it works this way. And that is the moment, that literally that one moment, because I spoke up, that doctor not only started giving me more patients or, expecting, and he was like, Lubna, do you have any updates for me? Do you have anything to share? He literally sent me on a procedure because so I was in a surgical ICU, so there was a lot of anesthesiologists and critical care doctors. He literally sent me on a procedure with another doctor who wasn't even on service. He wasn't even supposed to. He literally called him and I was just grabbing coffee and he goes like, are you busy? And I was like, no, absolutely not. I can throw this coffee. What are you? And he goes like, there's a stellate ganglion, celiac plexus block, anesthetically. Do you want to go see that? And I was like, of course, this is why I came from Pakistan. I'm coming. And he literally introduced me to that doctor that, she's one of medical students, but she literally functions at the level of a resident or something. And, since that day, I know that he's noticed me.
Yeah.
He has noticed me. And then my residents and fellows, they would just try to, because I'd become friends with them and I was like, I really need LORs from this place. And they were like, you know what, we have a plan. We're going to ask you questions in front of them and you're going to answer them. And then they're going to, so the fellow would specifically ask me questions. And I wouldn't know them all the time. I wouldn't say that
Yeah.
I knew the answers, but I would try. And I think that's what they saw. So, this is what I tell everyone. You don't need to be super smart. I had my knowledge was very rotten from step one. I would review some of the things, like for example in surgical ICU you're working with ventilators and pulmonology,
Yeah.
a lot of that. So whatever rotation you're working on, I would say definitely review that. Don't completely go blank on that. But again, you don't need to prepare for it like it's an exam.
Mhm.
But be curious and just always be asking questions. That is the most important thing to become prominent and be very social. I remember in Mayo Clinic, I once said no, that the residents were like, hey, we're grabbing lunch. Do you want to come? And I was very shy. It was my, I think, day two or day three. I was like, yeah, I'm good. And I remember one of them was so nice. He later on told me, so I was like, never say no. You always want to connect. You
Right.
are here to
Yeah.
make connections. If you're going to sit
Yeah.
here in the computer room, only working on your patients, you're not going to get that. And I was like, you're so right. You
Yeah.
know, so I think these are the little things that they don't tell you because they just, obviously, and I understand that getting an elective feels such a big deal that, oh my
Yeah.
God, I have an elective at least. And performing on it comes on way later, probably when you're entering the hospital or when you're getting ready, when you have the badge for it. That's when it hits you. That's when you get nervous. But before that, you're only so focused on, I hope I get a rotation. But
Mm.
these are the little things which make a true difference in getting you good LORs. And I think it's high time that, people learn that it's not about the big names, but it's about
What is the
what it
LOR?
is written on.
Definitely. That's actually great advice. I love how you're explaining everything in so much detail because these are the things that we need to know as people who will be applying for the match in the future, inshallah. And it's a lot of things. It's LORs, personal statement, steps, everything, and then coming on to interviews. Interviews are such a huge deal of the entire process.
Generally think when they, a lot of people say this on internet as well, that they don't want to know, about your accolades. They don't want to know what you've achieved. And that's true actually, because they have it in front of you. They really actually just want to know, is this person going to be good enough to fit into my hospital, if this person gonna not gonna throw a fit at 2 a.m. or something, because it's actually very right. All my interviews were very conversational. I mean, I was very anxious before them for sure, because you are just, you think, because we've given so many vivas, especially in Pakistan,
Oh,
you are
yes.
just somewhat, mixing that. Oh my God, is it gonna be a viva? Is it gonna be a viva about me? Are they gonna ask me things? I think but they're very conversational. They're very chill. I remember one of them really just, I think it was the interview I gave at Mayo Clinic. She was so nice. She was literally just talking about this personal issue. I told her that, someone very close to me had passed away like 10 days before my step two and everything. She went on, she literally spent like 10 minutes, talking about that person. And I was like, oh my God, this is so nice. And they actually just look very, I think they're very conversational, and they're actually just gauging the fact that A, is this person actually real, what
Yeah.
they've shown on their CV and their true personal statement, and B, is this person like an actual human.
Hmm.
I was so candid in my interviews that I did mocks with a few residents, senior residents that I had from Zaudin, a few seniors, and they all were like, this is fine. They were, a lot of them had given their fellowship interviews in the moment. They were like, this is how it is. And I was at one point, someone made me feel like you are being too casual, and I was like, but I just want to make it, conversation. I don't want to sound like rehearsed,
Yeah.
report, even though I had written down my answers. I had my pointers. I had made a document. Tell me about yourself. What are your strengths? What are your weaknesses? All those generic questions that they ask. And if you could be an animal, all that. So no one asked that. They actually no one asked that. But this, I think, no one, they didn't even ask anything about my CV except the program that I matched. And they asked me about my research. I actually just had two, and they asked me about this abstract that I'd published. But I realized that they were probably just gauging the fact that I have published it, because
Yeah.
it is a very common norm to just get your name in it,
Mhm.
just somehow get into a research.
Yeah.
But he literally went the core of it, and to the point that, is it novel, is it not novel, what was your thought, how did you choose this topic, because I was the second or third author of it. So I think even in that, I definitely blanked out. I actually, like, I this was why I was not thinking that I would match into this place, even though I was like, this would be great, is because my interview, for me, it didn't go as great. I didn't speak that well. I think there were like things that were asked about my research, but I was like, it could have gone better. But at the end, because I matched, I think at that place, I think I realized that they were just gauging the fact that it's all true. And I
Yeah.
think you need to just be very honest about everything. I didn't make any big, great stories. Oh, like, what are my strengths? I was very basic, like, I'm adaptable. Why am I adaptable? I'm adaptable. I've moved cities. When I came to US healthcare system in ICU, there was a new attending. There was a different team every 2 weeks. I worked with them, and you have the LORs from that place, which will tell you how well I fit in or how well I adapted. So I think just being normal, because a lot of people are like, you have to look in the camera. I don't even think I've rehearsed. Even right now, I'm probably looking at the screen. They're like, look in the camera.
Yeah.
You don't cough, don't do this, don't do that. I was having such a bad ache. I was actually doing this in one of the interviews. They were like, "What happened? Are you okay?" And I was like, "I'm fine. It's okay." So I think just being yourself, for sure.
That's very real advice, because a lot of people, as you said, that they say that look at the camera, keep a note in front of you that says look at the camera. But even with me with the podcast, when I look at the camera, I cannot express my emotions completely. I feel that I'm just talking in a very robotic manner. I obviously don't want that. I want to talk like a human with the other human sitting across the screen. So I think that's definitely something. I think you should be very real, because they're just trying to see if you're actually the person who you represented on your CV and all of the letters. So that's great advice. But thank you so much, Dr. Najmi. I have so many other things that I would want to talk to you about. You have such great advice. The advice that you gave, it was so real, so valuable, especially for someone like me who's in this process, studying for the exam, looking forward to everything that's going to come in the future. This was great advice. Thank you so much for taking out the time. And I hope that you have a great year ahead of you, great 3 years ahead of you in residency. And I hope that maybe I can meet you in New York sometime. And
Inshallah.
thank you so much. This was amazing.
So much. Honestly, it's my pleasure and it's my honor. This whole thing that you're doing, it's so great, and I'm honestly like so proud of you. I'm just like I'm actually like very proud of you. I'm fascinated. But thank you so much. It was great pleasure talking to both of you. I think I took too much time because I go on a tangent, but definitely, if you guys want to talk more, I'll be down for it because I think it's very important. There's definitely a lot of guidance videos and the people are doing great job at it. But there are a lot of still things once you get into the thing in the real deal, the match and everything. There are things which you want like some very real advice, like candid, and you just want something which is like just be normal and tell me, so I think, yeah, definitely. And I wish you both the best of, the very best. Inshallah, you both, I think Sahar is gonna do all of it, but inshallah, you're gonna reach there soon. And Anusha, for you, I have a lot of I'm sending a lot of prayers your way. And if you need any help, you can always reach out to me with your step two, and the match. I know it's a very anxiety inducing thing, like the whole journey. But take it one step at a time. Like for now, just think of step two. This would be my thing for you.